Do you or someone you know suffer with chronic back or neck pain that time alone hasn't seemed to help, nor have the pills or the therapies, and you've heard horrible things about the shots? Maybe it's time for a fresh look by a group of physicians who have traveled the world over looking for solutions to common and chronic pain that nothing else seems to help. Maybe a high-powered laser, and not your everyday laser, but a high-powered 60-watt Class 4 laser used on professional athletes like the Pittsburgh Steelers and other sports teams to help their most chronic and painful problems in their back or their neck. Perhaps it requires something like PEMF, pulse electromagnetic field, and not just any PEMF. This is a pulse center device that is a professional version, not a home version, that has been shown over and over again to help with chronic pain that other things, including opioids, don't seem to help. Perhaps it's a little more involved with tight nerves and tense muscles that have pulled vertebra out of position. And perhaps a gentle neurospinal alignment is required to reposition the vertebra and allow the muscles and the nerves to gently relax. Perhaps it's gone a step further, and now we have structural damage with bulging and herniated discs pressing on delicate nerves and your precious spinal cord. Maybe it's time to step up to something like a coxflexion distraction, which has been shown to gently realign the vertebra and allow the disc to begin to retract. Or perhaps it's time to step up to the gold standard in chronic neck and back pain. The VAX-D, vertebral axial decompression, for over 40 years has been the leader for chronic back and neck pain and has been shown in clinical studies, and this one at the University of Texas, where they inserted a cannulus or a pressure gauge inside the human disc and was able to measure for the first time ever and only that VAX-D allowed the pressure inside the disc to drop to a negative value. It's actually a process called distraction. And because that pressure had dropped to a negative value, it created a vacuum, which allowed the disc to be drawn back into its normal position, new type 4 collagen cells to form around the disc, allowing it to heal as strong as it was before. Unfortunately, traction and inversion tables were shown to actually increase the pressure of the disc, the exact opposite of what VAX-D allowed, which is why VAX-D is the leader and the gold standard for over 40 years in chronic neck and back pain that does not require surgery and is able to help 91% of people get out of pain, get back to the things that matter most. Something that surgery cannot touch, no other therapy can touch. It is the gold standard. In fact, as we look, this disc is nice and white and well hydrated. The L4 disc is clearly dried out, clearly ruptured into the delicate spinal canal, pressing on the spinal cord. The L5S1 disc is clearly thin and drying out. After their VAX-D treatments, we can now see that the L4 disc is being retracted. It's 2 shades lighter than it was prior, and the L5 disc is now twice as fat and white. And in fact, the disc is being healed. We can see how much lighter that's becoming as the disc heals itself. See, surgically, if you just whack that part of the disc off with a surgical, it's called a discectomy, the disc is still black, right? This one is still dried out. It hasn't restarted the pumping mechanism, which is why 53% of back surgeries fail within 6 months and over 90% fail within 4 years. VAX-D is the leader, has been the leader, and remains the leader and the gold standard in treating chronic neck and back pain. New to the field of medicine is stem cell therapy, right? We have a team of medical physicians who, under fluoroscopic guidance, so a motion x-ray would guide the needle, they can inject a stem cell to allow to help regenerate the damaged discs. And what that looks like, as we can see here on the left, clearly we have healthy, white, well-hydrated discs. These are thin, dried out, clearly herniated. But on post-examination, after stem cell therapy, we can see those discs have retracted and even regained their fluid and allowed themselves to heal. So what do we do next? Call 724-458-1100 to schedule your evaluation, X-ray, and/or MRI review to fully uncover what is truly wrong with your back and what level of care is required to fix it so that you can get back to doing the things that matter most.